Welcome to the Women's Money Wisdom Podcast. I'm Melissa Joy, a certified financial planner and the founder of Pearl Planning. My goal is to help you streamline and organize your finances, navigate big money decisions with confidence, and be strategic in order to grow your wealth. As a woman, you work hard for your money, and I'm here to help you make the most of it. Now, let's get into the show. Well, if you are at the water cooler nowadays, talking to friends in conversations on social media, I've seen more and more conversations about the cost of healthcare, especially renewals of insurance premiums, than ever before. And I know that's a topic that our listeners are dialed into, whether it's for themselves, their kids, important family members, or, thinking about their friends. So I thought we could have an episode before the end of the year during this open enrollment period where we dive deep on the reality of health insurance in 2025. And in order to have that conversation, I brought in an expert who really knows about health insurance for all ages. Cole Craven is the co-founder and head of growth at Move Health. He lives in Evansville, Illinois with his wife and two sons, and he has a passion for creating an empowered and informed healthcare consumer through effective healthcare planning. So he works with financial planners like myself to make sure that clients like you have good information to make informed decisions about healthcare. I think you're really going to enjoy this conversation. And Cole, welcome to the podcast.
Thanks, Melissa. Appreciate you having me. And I'm a Hoosier at heart, and so there is an Evansville, Illinois, but I'm actually Evansville, Indiana. Funny enough, and so it's all good. If my Evansville crowd listened to it, they would never let me live it down.
Yes, thank you for the correction. And go Hoosiers, #1 in football this week. We're recording right at the end of October. So congrats on that.
That's exactly right. We've got it's an interesting time to be an IU Hoosier football fan. We have historically been a terrible football school, and now look at us. So the power of the transfer portal and this new world that we live in. And so similar to that, there's been the winds of change that have blown into, college football and NIL and all those things. I mean, in the healthcare space, if I could make a really cheesy segue,
Please
right?
Do.
We've got some big changes. We've got some big changes that are coming up as well. And so excited to talk through those with you, and, interested in hearing what your listeners are really keyed into.
Well, I think that really tees it up. Healthcare is constantly evolving. Insurance is such an important component of your medical outcomes, the way you see your ability to access healthcare. If you work for an employer that offers you a stable healthcare plan every year, subsidizes your economic costs of that healthcare, then I still think you should listen in, because the health insurance marketplace may be there for you at times when you have a transition. But this conversation is really about those who are looking for access to health insurance beyond their employer plan. And again, like if you plan to retire early, pre-age 65, this is absolutely relevant to you. So could you give us a lay of the land of the ACA marketplace? And, we're talking about pre-65 health insurance. What does that even mean nowadays if somebody hasn't been covered by it?
Yeah, really good question. And so, Melissa, you made a good point. This is really going to be very applicable to folks that don't get coverage from a job, right? So anybody that's getting health coverage outside of a job. Some fun facts about how people access coverage in the United States is, 50% of the United States gets health insurance coverage through their employer or through a parent's employer or a spouse's employer. 50% of the United States. There is 15% and growing really rapidly that get coverage through Medicare, right? Medicare is for those that are over the age of 65 or disabled before the age of 65. 20% of the United States gets health coverage through Medicaid. Medicaid is state-based, low-income, typically income-based health coverage through your state. And then the kind of last piece of that puzzle, right? If I do the math, I'm going, okay, 50% plus 20% plus 15%. I go, okay, that's 85%. There's still 15% of the United States that's in this bucket that has to buy health coverage outside of a job. And what we have seen is over the past several years, that number has continued to increase and increase and increase. And there's a couple of reasons why, but we're going to key in specifically to what that space looks like right now. And so pre 65, this could be someone who is, a small business owner or an entrepreneur or a contractor or a gig worker. One that we serve really, really often, and really the entire reason I wanted to start Move Health when we started it was the early retiree. I watched my in-laws struggle with this decision, and I watched health insurance be the linchpin in their financial plan before they felt comfortable saying, okay, we're ready to retire. We're ready to spend more time with grandkids and on hobbies and all these things. This was the blocker to them feeling comfortable. There's a lot of people that are sitting at jobs right now that are like, I'm financially prepared to retire. I feel good about that piece of the puzzle. Maybe I've worked with Melissa, our financial planner, who's helped us to feel really confident in our financial plan. The last piece that we need to put into place is health insurance. And when I leave my job, I'm no longer going to have health coverage, right? Or I need to take Cobra, and I hear that that's really expensive, or I hear that the marketplace is challenging and all these things. And so the goal, let's cut through some of the noise when it comes to when it comes to that. And so in the pre-65 space, some of this is state dependent, but in the pre-65 space, you really have a couple of options. If we're looking at, just as an example, of someone who is retiring before the age of 65 and they're saying, I need to find coverage, I'm leaving a W-2 salaried job, you're going to have a couple of options. Option one, in no particular order, option one is Cobra, right? So Cobra is not, it's not a snake. It's not an insurance carrier either. Cobra is not, you don't get coverage through Cobra insurance. Cobra is a law. It's legislation from the 80s that says when you leave your job, you have the ability to continue your employer benefits. But the downside of Cobra is, yes, you get to keep your employer benefits. It's the same plan. You carry it forward. So if you retire mid-year or you leave your job mid-year, you elect Cobra. If you've already paid into deductibles, it stays the same plan. So you've got that deductible that's, you paid into already. So you're not resetting a deductible mid-year. The downside of Cobra is that when you leave your employer, typically they are going to take away all of that employer subsidy, right? And so whatever the employer is paying, they no longer pay when you are on Cobra. And so you're paying 100%, both the employer portion and the employee portion.
I
And
was
to add
just
insult,
I was just explaining to someone who's getting divorced, and she has the health care. The spouse is like, that's fine. I'll just take it with me. I'll use Cobra for 3 years, because in a divorce case, I believe it's a
sure.
36-month period. And I was like, okay, you need to check that price, because it is not it is not highly subsidized, and it
Right.
just does not work that way.
Yeah, and so you're paying 100% of the premium, and it depends on the plan that you have and who's on it and all those things for what your cost comes out to. But regularly for a couple, we see Cobra costs that are anywhere between $2,500 a month and $4,000 a month, right? For Cobra coverage. And so a lot of people don't understand your employer, they pay a lot for your health coverage many times. And so, Cobra can be expensive. Adding insult to injury, there's a 2% administrative fee that gets tacked on top of that. So typically you're paying 102% of the actual cost of that plan. And Cobra can be a right fit for some people, right? If you've already hit a maximum out of pocket or a deductible for the year, or you are piling a lot of income into a year, you have very specific healthcare needs. Those can be all good reasons to stick with Cobra. Because it's yes, it's expensive, but it's going to provide the most stability in terms of, hey, I'm already seeing these doctors, I don't need to change anything. You could also make a change to other coverage and still see the doctors you needed to, but in the event that you're undergoing current treatment or things along those lines, it can make sense. Again, you don't have to reset a deductible. So when somebody comes to us I know we're recording this at the end of October, when somebody comes to us and says, hey, I'm retiring at the end of November, just before Thanksgiving or whatever, okay, great, that's awesome. We might just elect Cobra for that month of December, right? Because there's no sense in resetting a deductible for 1 month and learning a new plan for 1 month only to have a new plan start on January 1 again. And so all of that to be said, Cobra is a good option for folks that are either in a high income year, or they're undergoing current treatment, or they really, really like their plan. Or sometimes an employer, if you have a severance package, sometimes they'll actually cover COBRA premiums
Hmm.
to a degree. And so if you
Sometimes
have
that's
something like that,
negotiated into the severance
right.
package. It might not be the first offer, but then if you have, a little pushback or there's reasons to, you know, uh, kind of dispute or ask for a modification of your severance package, I think that's one of the first things that employers are willing to kind of work with.
Yeah, I think that that's right as well. And again, don't be afraid to ask. The worst that can be said is no, and you might really win as a result of that. So that's option one. That's Cobra. Another option, and it's funny, in the space that we are in health insurance and in Medicare, specifically in the pre-65 space, people will say, well, I don't want the marketplace and I don't want Cobra. I want private insurance, right? And I'm using air quotes here. I want private insurance. And private insurance is a bit of a misnomer in the sense that it's a different definition to every person of what private health insurance is. So I'm going to exclude the marketplace from private insurance in this instance, and I'm just going to reference off marketplace coverage. And typically, what off marketplace coverage would be is I could go to insert the name of a carrier, and I could say I want an individual and family plan, and I want to be able to enroll into it. And there's a couple of different flavors of off marketplace. There's an option where you might have to undergo some medical underwriting. They might actually ask you some medical questions, and it might work similar to how health insurance worked before 2014 in the individual space, where you had medical questions and they'd ask for your height and weight and all those things, and they would either say, "Hey, we're gonna accept you. Great, we're really excited about having you covered on our plan," or they might say, "Oh, we don't like that prescription medication you take, or your height and weight are out of whack, and we're gonna rate you up." Or they might just say, "Hey, you told us you had that surgery in the past 3 years. Sorry, we're not going to cover you." Right. So there are still health insurance plans you can buy that have a medical underwriting component, where they'll ask you some questions and run a medical information bureau check. The benefit of these is if you are someone who is healthy, and has limited medical expenses annually, it can be a fit for those people. It can also be a fit for people that are, again, healthy, don't have chronic conditions, and are high income, right? Because it's not going to be your income is not going to play a factor. We'll talk about that here in a moment. So that's kind of the off marketplace side. You can go direct to an insurance carrier on occasion.
How often does
Um,
that happen? Is that infrequent typically?
I would say it's fairly rare, and the reason being is a lot of times these are the same plans that are on the marketplace, just with no tax credits applied.
That's what I thought.
Um,
Like you're literally just going without like kind of giving yourself a first look for the tax credits, right?
right, exactly. And so you've got that. There are also like short-term health insurance plans, and these are going to have medical underwriting component to them. They're also not going to cover the three Ps: pre-existing conditions, prescriptions, or pregnancy. And so if any of those apply to you, short term's probably not there. That can be a fit again for folks that are in between jobs or have a short period of time where they're trying to cover. It can be a fit for people who want to keep them longer term, again, if they are healthy individuals, et cetera, but they will have some exclusions. So when we think of the private insurance space, a lot of times that's just characterized by going direct to an insurance carrier and getting a plan specifically through them. If it could be United Healthcare or Blue Cross Blue Shield or Anthem or what have you, you can go direct to a carrier and do that. It's not always the best option. Sometimes they're going to have a medical underwriting component, and with that, you might end up. There's two caveats to that. One being you might have a situation where you're high income and you're healthy. Great, you might go off marketplace, and it potentially could save you money, right? Because through that underwriting component, they're reducing the risk pool and all of these things that benefit you. And we'll talk more about the marketplace here in a moment. And so you've got that component. The other side of it is on the private insurance space, off marketplace. Be very, very mindful of weird. We've seen really weird exclusions, right? Or things that are left out of a plan. Make certain you read the fine print. And this time of year, as we near open enrollment period in the fourth quarter of the year, anybody that has ever searched health insurance on their phone or on their computer is going to be inundated with advertising. And my statement to anybody that's seeing that is, if there is a plan that looks too good to be true, it probably is, right? There's trade-offs in everything. And so if you see we've got nationwide PPO networks that are going to cost you less money and all these things, there's a place where the trade-off happens. It's either going to be really expensive on a monthly basis, or there's significant exclusions or underwriting or things along those lines that make that happen. So
Can you give
it's kind of the
me
private
like
space.
an anecdotal weird exclusion that you've seen? Of course, this is not blanket. Don't
Yeah.
assume, but like what's something that came up where you're like, are you kidding me?
Yeah, and I don't want to paint all off marketplaces negative, but I will tell you one that we experienced that was really challenging was someone who came to us after they had already enrolled into coverage, and they had a sometimes you'll see these things called association plans, and they'll say we'll make you part of the Small Business Owners of America Association, and with that you get access to our group health plan, right? And really it's a group that's built to create a group for health coverage. That said, those can sometimes have weird exclusions. And this person came to us in crisis because they were needing a transplant. And when you read the fine print on, this organization's group health plan, one of the first exclusions was transplants. And this was a life or death situation. They had to get this figured out, and their health coverage was saying like, no, it's part of our contract. We don't cover that. And so again, be sure to read the fine print, make certain you understand what a plan does or doesn't do, make certain you're working with someone on that is not, you don't feel like you're being sold to. And again, if it sounds too good to be true on the private insurance space, it's kind of I'll call it off marketplace. It probably is. And so, with that, I think one of the better things that happened to the health insurance landscape was the Affordable Care Act. And, this has been referenced as Obamacare and Trump care and Biden care and all these things. And each presidential administration has had kind of their own spin on how they've treated it and how they felt about it. But all that to be said, prior to 2014, there were lots of people that would say, "Hey, I'm 58. I'm financially ready to retire. I'm ready to go. I had a heart attack 2 years ago, and it just really put things into perspective for me. I think I need to slow down and stop working, retire, and enjoy these years." And we would have to tell that person prior to 2014, "I'm really sorry. You're going to have to leverage Cobra for as long as you can, but you're not going to pass underwriting." So prior to the Affordable Care Act, all health insurance on the individual space was pretty well all that was medically underwritten. So they'd ask you questions, and if you couldn't pass underwriting, you either didn't have health coverage or you had to continue working, or find a job that did provide it. So that was a different spot.
Yeah, I don't think like new generations won't understand um how critical that was and how difficult it was if you had just an adverse chronic condition. And the reality is, as I've turned 50 this year, the older you get, the more pre-existing the more time you have to have pre-existing conditions where, the picture of health at 60 still has probably a few things on their medical records that could be considered adverse to insurance companies.
That's exactly right. And so, if we think about what the Affordable Care Act was or is, in 2010, the Obama administration, they ran on we're going to create this Affordable Care Act. Patient Protection and Affordable Care Act is the full name of it. The largest piece of healthcare legislation ever passed by a long shot. And, in a really quick 30 seconds, what it did was, the Affordable Care Act said, okay, we are going to create this thing called the Affordable Care Act Marketplace. There were a lot of other things that were impacted by the Affordable Care Act, including hospital billing, et cetera. But for our purposes during this conversation, it created the Affordable Care Act Marketplace, and it said within 4 years we're going to build the Affordable Care Act Marketplace, and the marketplace is going to have participating insurance carriers that are going to say you can get coverage with a pre-existing condition. We're not going to ask health questions. The only questions we're going to ask are your age, your income, your location, and your tobacco using status, right? Are you a tobacco user? And so really the tobacco use is really the only thing from a health perspective that an insurance carrier that's participating in the marketplace can really rate someone up
Can
on.
use to discriminate, basically.
Correct. And they can't deny you. They can rate you up though,
Okay.
right? On tobacco use specifically. So as we think about that, an insurance carrier employs all of these people that are called actuaries, and actuaries are people that are much smarter than I am, but their job is to adjust risk and to make certain that the insurance carrier, remains solvent. They have enough money to pay the claims, and that they can make money as an organization. And, an insurance actuary, when they hear this Affordable Care Act being passed, and they're saying, oh, we're going to participate in the marketplace and we have to accept everybody. And these insurance actuaries are going, okay, I guess we have to assume everyone's now in the highest risk pool, right? And so when the marketplace was started, Jan 1, 2014, overnight plan premiums went up 300% overnight from December 31st, 2013 to Jan 1, 2014. And this was a result of them saying, hey, we're going to have a whole bunch of people that have needed health coverage that are sick or have chronic conditions or have pre-existing conditions, and they're all going to join these plans. So we just need to assume everyone's in the highest risk pool. And that's how we're going to create our premiums. And so the Affordable Care Act, right from the jump, didn't make things affordable, right? You could argue that. Now, the Obama administration knew that this was going to happen. They were smart. They had enough foresight to say, okay, insurance actuaries are going to react in this way. Carriers are going to react this way. We want participation from carriers on the marketplace. We need to figure out a way to make this affordable. And so what they did is they created these things called advanced premium tax credits. And so there are some folks that are going, okay, I know what an advanced premium tax credit is. But an advanced premium tax credit says, hey, plan premiums went up 300% overnight. We knew that that was going to happen. We know that these plans are expensive. We're going to federally earmark dollars that are going to reduce the cost of your plan based upon your income. And so this is not Medicaid. This is not low income only. This is something that people can take advantage of. And the way that they work is, prior to a couple of recent changes that we'll talk through, is if you're at 400% of the federal poverty level or below, as a part of the original Affordable Care Act, you could get these advanced premium tax credits or these subsidies on your health insurance. And so, Melissa, I
And
know
what are we
you are.
talking about? Like 400? What is 400%? I know is it geographically based as well for the
So
poverty
it's
line?
not.
Okay.
It's the federal poverty level, and so it's not geographically based. They release these numbers every single year. The Affordable Care Act does. The federal poverty levels are, and with that, as an example, in 2026, they haven't released these numbers yet, which is unbelievable. But they haven't released them yet. 2026, we believe that for a couple, the 400% number is probably around $88,000. And it's $88,000 in modified adjusted gross income. And so, Melissa, you've been a planner for a little while, right?
A minute. Yep.
And so, we'll talk about some of the changes that happened, from 2022 and on. But, prior to that, the Affordable Care Act, you were probably working with clients to help them, keep income below those thresholds. Yeah.
Definitely.
Yeah.
Especially for early retirees, right? Like if you're
Yep.
self-employed, there's not a lot of advantage to not making money because that is what you're talking about. But when you're an early retiree, there can be a lot of access to funds depending on how you've saved and earned without reporting taxes for them in a legal
Yep.
way.
Exactly. Yeah. We're no one's doing. Yeah, we're all above bar here.
Yeah.
And these advanced premium tax credits prior to 2022, if you were within 400% of the federal poverty level, you could take advantage of these tax credits. And the way that it kind of worked within that window of income was like a sliding scale. The higher that your income went, closer to that 400% of FPL, federal poverty level number, your premium went up because your tax credit that you received reduced. And vice versa, if you could keep your income lower, there were times where you could take advantage of a lot of these advanced premium tax credits. And so, there are multimillionaires that we work with here at Move Health that are able to, with the work alongside of a financial planner, keep their modified adjusted gross income very low. And so they pay very little for health coverage on the marketplace. And again, the benefits of the marketplace being you can get coverage with a pre-existing condition and layering on this piece of advanced premium tax credits. And the marketplace is not a place where you go and get like, Acme Insurance Company or, whatever. These are real insurance carriers, the United Healthcares and Humanas and Blue Cross Blue Shield, all these that participate. And so these advanced premium tax credits are a big piece of a financial plan, oftentimes.
Absolutely. This is, sticker price is one thing. The premium tax credits are a huge component of the planning and accessibility. And it's why you shouldn't just, be like, I can't retire because I can't afford it. But you should also be planning to pay for healthcare. I think sometimes people just assume because they may choose like a low deductible plan, have their, their workplace pay more. They're like, hey, you should have it's not responsible to pay for medical costs. And the reality is you need to disavow yourself of that in many cases. Um, so anyway, that's what I think.
I think that that's spot on. I think that it's one of those pieces that a a retiree specifically can really let sneak up on them, of where they go, okay, the kids are through college, the house is paid off, I'm diversified from a tax perspective. The glide path on my money looks good. So we've answered the big questions of, do I have enough money, and am I gonna be able to make it last the rest of my life? That's great. The next one that kind of gets them is, oh, totally forgot I'm gonna have to buy health coverage, right? I'm gonna have to figure this out. And the marketplace can come in and be a big piece of that, because it's no longer a gating factor. If, oh, I'm not healthy, I can't get health coverage. That's not a factor anymore. So these advanced premium tax credits are a great way that you can actually reduce your health coverage costs. There are some people that just are not going to qualify for an advanced premium tax credit because you earn too much to do so. Now, in 2022, go ahead, Melissa.
I was going to say, but every year matters, right? So I work
Correct.
with a family that sold a business in 2024. 2025's income was also quite high, but 2026 is a different story. So every single year matters. It's not like you're set in one, kind of premium class based on any particular year. It becomes a moving target, and the same goes for Medicare. We're not going to talk about that today, but your income matters every single year.
That's exactly right, and a really good call out. There's often times where they say, "Well, I've got too much in assets to get those tax credits." It's actually not related to your assets at all. For
Right.
the Affordable Care Act marketplace, it's looking at what your current year's modified adjusted gross income will be. And so it's not looking back, it's not looking forward, it is looking at your current year's income, what you estimate that to be. And so that's what those advanced premium tax credits are built on. Now, as a part of the American Rescue Plan Act, which was a COVID relief era piece of legislation, they actually took that income cap off at 400%. And they said, hey, anybody can get these tax credits, and we'll subsidize the cost of a plan down to 8.5% of your modified adjusted gross income. And so, an unsubsidized marketplace plan, as an example of, if you went and just bought the middle of the road plan for, let's say, a 60-year-old couple, they might be looking to pay, if they're totally unsubsidized, between $2,500 and $3,000, right? And this is going to be dependent upon location and things like that, and carrier
You're
you choose.
talking per month or per year?
Per month.
Yes.
Yeah, per month. And
Unsubsidized.
so
Right.
unsubsidized. Yep. And so the American Rescue Plan Act came in and said, we're just going to subsidize that down to 8.5% of that person's modified adjusted gross income. So it doesn't matter if you're over 400% of the FPL any longer. So if someone stopped me in the grocery store and said, Cole, I make $100,000 a year, and my wife and I are planning on retiring soon, what's our health coverage going to cost? And say, well, plan for probably around $8,500 a year in premium, right? And this was a part of the American Rescue Plan Act. And so currently, through the end of 2025, these advanced premium tax credits, they work like a spectrum, right? Where there's no longer that 400% block, where if you're over 400% of FPL, you don't get tax credits at all. It's right currently, it is a spectrum. And with that being said, is example in Indiana, where I'm at, a couple in early retirement can make north of $250,000 a year and still get a tax credit on the federal marketplace. And that is set to sunset at the end of this year. And so you might hear, if you're listening to this, you might hear, the government right now, as we talk on the end of October, the government's shut down right now. And part of the reason that they're shut down is over these enhanced advanced premium tax credits. Because at the end of 2025, that 400% income cliff, as you will, comes back, where they're saying, hey, if you're over 400% of the federal poverty level, you no longer get these tax credits on the marketplace. And what that has been misconstrued as, and what that has been heard as on news and all those things, is tax credits are going away. And that is not true. The Affordable Care Act is not going away. Tax credits are not going away. They're simply reverting back to how they worked before 2022. And to some people that have only been on the marketplace for 2 or 3 years, this will be a big surprise. For those that have been on the marketplace before 2022, this will be, hey, it's reverting back to how it worked in previous years.
Although I will say, I know it is much more painful to feel like you're losing versus feeling like you're winning. So, even if pre COVID era, kind of subsidies on steroids or tax credits on steroids. I feel like it will be shocking to a lot of people. And the other thing that is going on, and maybe you can comment on this, Cole, is health insurance premiums just in general are not, we've had high inflation in other areas, but I believe, and you correct me if I'm wrong, at least based on the renewals for my own small business, health insurance in general is going higher just across the board because of other factors going on in kind of
Yeah.
the state of healthcare in the United States.
Yeah, I think that, and I think we talked about it, Melissa, in prep for this. There's no magic wand, right? Unfortunately, there's not a magic wand that we're going to be able to wave and make premiums magically go down. A good financial planner can by doing some income planning,
Yes,
right?
absolutely. In
But
certain
but
cases, I should say, not
exactly
all the
right,
time.
exactly right. That being said, as we look towards the end of 2025, the government has shut down over these enhanced advanced premium tax credits.
Yes. As of
You
now,
know,
we may have a resolution or outcome.
at any
If
time.
anything, it could be just reverting back to what it was scheduled to be at the end of the year.
Yep.
Likely a compromise, if not the full
Yep.
boat,
Yep.
perhaps.
Yeah, and again, if I am certain you use the crystal ball methodology on occasions, like if I had a crystal ball, I could make some guesses. There's going to be some form of a compromise. I think we will still see an increase on the marketplace
Yeah.
specifically. Um, but it seems like there's general consensus around we don't hate the enhanced advanced premium tax credit. We think it's not necessarily a bad thing. I think that has bipartisan support. I think it's just where the funding's coming from at this point is what's
Yeah.
really kind of up in the air. All of that to be said, we have to plan as if that it's going to act just as the legislation is written, which is at the end of 2025 that 400% income cliff comes back. And so with that, Melissa, your experience with health insurance and for the small business as well, in general, what we are seeing is, we had a huge mix up in 2020 with COVID, right? Where there were insurance carriers, whether it was, home and auto or health insurance or what have you, where they, didn't know necessarily how to respond to this. And, this as a financial planner in the health insurance space specifically, that they're, health insurance, I think all planning softwares typically inflate this much higher than than the
Absolutely. This is
normal
not a
inflation rate.
surprise.
Yeah.
Yeah.
And so it is something that continually becomes more expensive. And I wish there was a magic wand we could wave to, figure out how to reduce rates in the United States across the board, whether it be through an employer or through the marketplace or things along those lines. But some of those contributing factors as to why we're seeing those increases in the United States, one is as a country, we are aging, right? We all get older each and every year. And as we think of the bell curve or the curve of where people are at in age as far as the United States, there's 60 million people that are over the age of 65 in the United States. There are 40 million people that are between 55 and 64. And so as we look at the US population of 330 plus million people, a third of them are over the age of 55. And with that, you see some of those expenses continue to rise, and insurance carriers having to handle those larger claims and number of claims as people age and all those things. That's one contributing factor. The other piece to that is the providers, right? I'm going pretty high level here, but providers are charging more, right? And so doctors and hospitals and all those things, and so insurance carriers are being forced to pay more. And so with that, you end up in this situation where you can solve some of the symptom, but really the root of it is what does healthcare cost in the United States? And Melissa, you and I would be very wealthy people if we could figure out how to solve that problem today. But what we can do is we can plan for it, right? And that's the bigger piece of the puzzle. And so
Yeah, and I
if
would
I had to,
just mention, like, there's not a lot of conversation in any policy rooms that are at least getting public airtime about any new system, right? Like, I think we've all gotten pretty darn used to ACA marketplace, like, regardless of what you say, when a microphone is placed in front of you,
sure,
constituents in every state are utilizing these marketplaces.
yep,
But ignoring that there is an economic responsibility for you as for most consumers when they use these plans, and getting used to paying for your medical costs in a different way and planning for that is a critical component of preparation and preparedness for whether it's retirement or being self-employed, like all of that stuff.
Yeah, I think that's one of the biggest things that we try to do when we are planning with someone is don't let these costs sneak up on you. And that's a lot of times why we at Move Health are working alongside financial planners, right? We're arming an advisor or a planner with, data on the front end to say, hey, here's what costs may look like for this client. If they're going to be fully unsubsidized next year, they should be planning for $2,300-$2,400 a month if they're over 400% of the federal poverty level. And so as we think about those things, it's really, really important. Plan for it, right? As you are nearing retirement, as you are nearing that jump to entrepreneurship from your W-2 position, make certain you have a clear understanding before you make the jump. Don't let it be something where you go retroactive and you go, oh, I got to figure this out now. And then it becomes a fire drill. So, it's one of those things where it is, I think as the kids would say, it is what it is, right? We have to learn to live and deal with it. And, it's sometimes what you get when you get, this between, the federal government and insurance carriers and this public-private partnership and all these things, it can get muddy and it can change, every time that there's legislation passed. And so, it's important to plan for it. It's important to review this and analyze this every single year. Even if you are on an employer plan, it's important to review and look at these things because, one thing that we are seeing often in the employer space, if I can give just a little nugget for those folks, it's not all bad, right? Your employer is still covering a lot of the costs. But what we are seeing on occasion is hey, it's $50 a month or $50 a paycheck for me as the employee. But then when I add my spouse, it then becomes $1,800 a month.
Yeah.
Why is that? Right. And it's because as a business, they're saying, hey, we're going to subsidize our employee. But the employee family or kiddos or things like that, we may not subsidize at all.
Right.
And so everybody, whether it's employers or individuals or, insurance carriers, I won't loop them into the same bucket as, employers and people, but everybody's feeling the squeeze is just where things are getting expensive. But it's not all doom and gloom, right? There's a lot of good that is happening. The Affordable Care Act, it has allowed millions of people to retire early or to go launch a business or to do those things that they've wanted to do because they can get coverage with a pre-existing condition. And
I would also mention we've worked with a lot of divorced women who had been on their spouse's coverage as well. And so that's another key component that I know we work with.
Yeah, absolutely. And as you think about, that transition, right? Our name, Move Health, is very intentional. When you have a big life move, there's a lot of times where healthcare planning comes into that picture. And anytime that you're experiencing a transition, it's an important time to review and analyze and make certain that you're making the most, effective decision and that you're not making one that is rushed if you can avoid it.
So can you talk to me, like that's what I'll leave you space to make a little bit of a plug. I will say that Move Health is one of the places that we refer clients to when it comes to health insurance. We actually pay a subscription to get access to Cole, your insight, your company's insight, resources that educate clients and assist with healthcare planning. We have a calculator. If you were considering retiring, what might you pay when it comes to if you decided to retire prior to age 65. But you're sitting here listening to this episode saying, hey, I have to make a decision by close to the end of the year. I think maybe we should be on the marketplace and we haven't done that in the past, or we're newly retired. How do you, because the reality is it is a marketplace. It is not a one size fits all. You just take what you get. So how do you get an informed consultation to make a decision versus and what could be the pitfalls of going to someone who's selling like one particular plan? Like what could you miss if you do that?
Yeah, I think I might butcher this, but if you think about the one size fits all solution person, I think the phrase is when all you've got is a hammer, everything looks like a nail.
Yeah.
And so there is some challenge there, right? But there are a couple of ways that you can kind of access health coverage, right? If you're looking at the marketplace or individual health coverage. One of them is doing it yourself, right? You could theoretically go to a healthcare.gov or your state's marketplace and find coverage and do some research and all those things, and you might spend 2 or 3 days, 4 days, a week on it, and
Two or three thousand emails coming in, because once you like expose yourself, it's just like an all-out
correct.
onslaught.
Yeah, and so you could theoretically do that. You could do it yourself, and maybe you feel good about the decision that you made. And they make it pretty easy to do as a consumer. What we do at Move Health is we're working alongside the client to, the process that a client follows is they're engaged by their financial planner to work with us. They start a client engagement. They fill out what we call their household profile, which just gives us all of the nitty gritty data that we need, what doctors you see, what meds. And then from that point, it allows us to go to work and say, okay, based upon all the information that's been provided to us, we're going to be able to present probably 3 or 4 options as opposed to the 93 that are available in your area, and be able to break it down and say, hey, because you said you see these 3 doctors, we're going to have to knock out these 2 carriers because they're not in network with that provider, or what have you. And so, getting to the point where someone can really understand my doctors are in network. These are what my prescription costs are going to be, et cetera, et cetera. And the one thing I joke about with our team, but it's real, is, I want someone to be able to leave a conversation with our team and understand what it's going to cost when they go to the doctor.
Yes.
I think that there is a large portion of the United States that could not answer that question right now. And, from our perspective, we want people to be informed and we want them to be empowered. And so, working with an organization, and this is not necessarily a plug for Move Health, but, working with an organization that is working genuinely in your best interest, there's a couple of kind of questions that you can ask to someone that's helping to guide you through a health insurance conversation. And are you looking at all of the available options in my area, right? Are you a captive broker or agent? That's kind of that, if all I've got to hammer, everything looks like a nail situation, where you might have someone who all they can sell or write or whatever is a specific insurance carrier. And they'll tell you how great that one is, and they won't tell you about any of the others. And so make certain that you're doing a thorough review. The other piece that I will, kind of leave with that is, if you were to go it alone and DIY it, there's no, when you do TurboTax, you can have a tax professional look at it. That doesn't exist in the health insurance space. And so make certain that, if you are DIYing it, that you feel really, really confident and comfortable that you have made the right decision. And if not, make certain that you are working with someone that you can trust.
Yeah, and you need someone who's going to say, hey, do you know what you're going to make next year? Now, we don't know exactly what you're going to turn in as your income on a tax return. But if you're working with a financial planner, first of all, if they say, I can't even give you a ballpark, and they're involved in your withdrawal decisions in early retirement, then you may need to reassess who you're working with. But, and I know that's not a part of the conversation for a lot of investment advisors, at least, that aren't doing financial planning. But, you need someone who's asking you to, assess, for example, that parts of it, those parts of information, or review your tax return from last year and say what's changing, things like that.
It's exactly right. I think and it allows you to do that planning that we've talked about, right? Health insurance premiums may go up next year, right? If we gave if I gave a takeaway from this, health insurance premiums are likely going up next year, right?
I got a 10% renewal for our group plan. And
Yep.
honestly, like, based on what I've been hearing, for all the
It's
reasons
actually
you
low.
described, was actually like, oh, just 10%. Like, and that's on top of a close to 10%, around 10% last year. So, if you think your employers are scrimping to you or they're changing plans, I think there's some like economic realities behind that for the businesses in general.
Oh, for sure. Premiums are likely to go up, but you can plan for it. You can talk with people that are experts in this space, and it's important just to be an informed consumer. Don't go into this flying blind. Don't wait until December the 14th to look at this for the first time. I know health insurance is not sexy to talk about, but it is something that is critical. And so make certain that you are taking a good look at it this year, and especially with the changes that are coming. And if you need really good guides, I think Melissa will provide some things that you may be able to give to the
Put in the show
listener.
notes. Yeah.
Yeah, exactly right. Things that you can review and look at, and things that we talk about each and every day that may help to calm some of those nerves and those thoughts.
Well, I will just mention, if I could just spend a minute or two talking as a financial planner, if you're getting ready for retirement but not quite there, and you think you'll retire before age 65, have a conversation with a financial planner like me about how you think about healthcare. Because, like I said, there's so many people that are in really good economic condition, financial condition, that think it's insulting and wrong to pay for, your deductibles, pay for some out of pocket expenses. And one of the things I ask people to consider first, I won't tell you can't, that you have to do it this way, but if you can keep some of your HSA, if you're in a higher deductible plan, for to be invested for the future, especially in retirement. A, you get used to paying some things out of pocket when you can afford it. But B, you have a bigger nest egg in a very tax friendly bucket that you can use for medical expenses once you retire and ongoing. Because the reality too is Medicare is when you start Medicare is a lot less than these like last years of ACA. We can have a
Yep.
conversation about that in the future.
Oh yeah.
But you still are going to have expenses. I had a client who has dental expenses in the
Yeah.
$50,000 range this year. And that's not out of the question, $10,000, $20,000 for coverages that just are not included. And, there are costs when you retire as well.
Yeah.
And I would also mention that don't assume that you know exactly what you should do. You think you should keep Cobra for 18 or 36 months based on your ability. It may be better to go into the marketplace. The marketplace is not socialized medicine. You're going to get private insurance in a way that allows you to get access to without pre-existing conditions, and also perhaps some premium relief. And do have conversations with professionals like Cole, ourselves on the financial planning side, because just assuming that everything is one way based on conversations with your neighbors or on social media isn't always the best advice.
It's exactly right. That's one thing that I didn't touch on, which is these decisions are very, very unique to the individual. And
Absolutely.
so whether this is Medicare or health insurance or what have you, your situation is not the same as your neighbors. It's not the same as the people you play pickleball with. Their experience with one carrier is not the same experience that you will have, et cetera. And so again, make certain you're informed and empowered and that you are looking at this from your lens, because we do see people all the time that say, I'm just going to elect Cobra and I'm going to keep that. And we go, well, if we look at the marketplace, your Cobra premium's $2,400. Your marketplace premium would be like $200.
Yeah.
You're like, oh, I guess I can afford to pay for, my
For the
whatever.
same company, similar plan in some cases.
Correct, right? And so there's a lot of times where we're kind of breaking through some of those preconceived notions. And so don't assume you know everything. I don't assume I know everything. I know quite a
Me
bit about
neither.
health insurance and Medicare, but all of that to be said, make certain that you are talking to somebody about it, bouncing it off of someone, and looking at it from your unique viewpoint.
Well, we'll have more details on where to find Cole in the show notes. Although I will mention, do you have any resources that are accessible, just kind of to general populations, a place to find you?
Yeah, good question. So we do podcasts like this all the time. So if you give a
Perfect.
quick search on YouTube for Move Health, you're going to find some resources that'll have either myself or
Perfect.
other members of our team kind of talking through what those look like.
Perfect. And thanks so much for enlightening us. I know this probably won't be your last episode if you're willing to come back someday.
Yeah,
And I really appreciate the insight on the 2025 healthcare marketplace.
of course. Thanks, Melissa.
Thank you for listening to the Women's Money Wisdom podcast. If you found value in this episode, the best way that you can support the podcast is to forward an episode to a friend or leave a review. Go to proplan.com and the podcast link to get all the resources and links mentioned. This presentation by Pearl Planning is intended for general information purposes only. No portion of this presentation serves as the receipt of or a substitute for personal investment advice from Pearl Planning or any other investment professional of your choosing. Copies of Pearl Planning's current written disclosure brochure and Form CRS discussing our advisory services and fees are available upon request or on our website platform at pearlplan.com. The information that we share is meant to educate and inspire, not serve as personalized financial advice. Everyone's situation is unique, so be sure to consult with your own financial professional for guidance that fits your life. And just so you know, the opinions shared in this podcast are Melissa's own and those of her guests. they don't necessarily represent any organizations with which Melissa is affiliated. For more important disclosures, please go to our webpage at proplan.com.